How's your voice feeling? If you're a singer, then like me, you probably ask this question multiple times per day. And there might even be times when that question is laced with some concern about your vocal condition and health. It's not unusual for a new student to enter the teaching studio here and, with a heightened sense of anxiety, ask me if they've damaged their voice. So today we're going to look at the top 7 signs your voice may be damaged and, more importantly, what you need to do to get your vocal health back on track.
Sound check.
G'day, my name is Dr. Dan and I'm a contemporary non-clinical singing voice specialist. I've been teaching singers how to train and care for their voices for the past 30 years, and during this time, I've worked with countless singers as they walk the journey of vocal rehabilitation. Now, before we go any further, I want to stress that the only person who can correctly diagnose the health condition of your voice is a laryngologist or a voice specialist ENT. All of the indicators of damage we will discuss in this video can be caused by various triggers, some organic and some functional. Organic triggers include pathologies such as vocal fold cysts and LPR, laryngeal pharyngeal reflux. Functional triggers might include vocal fold edema, that is vocal fold swelling, and MTD, muscle tension dysphonia. Interestingly, an organic trigger can lead to a functional disorder. Likewise, a functional trigger can result in a vocal fold pathology such as nodules or vocal fold hemorrhage. One of the first signs that a voice may have fallen into disrepair is a persistent hoarseness or a notable change in the voice. A complete vocal assessment is strongly recommended if your voice has a rough, breathy, or strained quality that persists for more than 2 weeks. The second sign of vocal damage that often concerns singers is a significant loss of range. Having suffered from undiagnosed reflux for many years, I know and now know that those unexplained periods of reduced range were a direct result of reflux-induced inflammation. The next sign, vocal fatigue, is not always easy to discern because vocal fatigue is a normal part of voice use. But if you notice a significant reduction in your overall vocal stamina, it might be due to an organic or functional imbalance. Fatigue of the voice is inability to continue to speak or sing for extended periods without change in vocal quality and or control. The voice may show fatigue by becoming hoarse, losing range, changing timbre, breaking into different registers, or exhibiting other uncontrolled aberrations. This quote by the world-leading voice scientist Professor Robert Sataloff highlights how one symptom, such as vocal fatigue, can involve other symptoms such as hoarseness. It once again reminds us that self-diagnosis is not an ideal option for correctly assessing vocal health conditions to their often complex presentation. On occasions, the voice user can experience pain and discomfort while singing or talking. While there are no nerve endings in the vocal folds themselves, we do have pain receptors in and around the general vicinity of the larynx, so throat pain, tension, or discomfort might be indicators that your voice has become compromised. Sometimes the functional issue of vocal fold constriction might lead the singer to frequently clear the throat. This might even be accompanied by a compulsive need to cough in order to clear the niggly sensation at the level of the larynx. Habitual throat clearing can lead to the exacerbation of tension-induced swelling, thus perhaps creating more extensive problems. A better option for throat clearing is to swallow. Before discussing the final 2 symptoms, it's important to note that prevention, it's always better than cure. Many of the functional issues that can arise for the singer can be avoided with good vocal hygiene and voice care. Remaining hydrated, observing times of vocal rest, and reducing vocal strain with stylistically appropriate vocal techniques are all essential factors in minimizing the risk of vocal damage. If you're ready to take a deep dive into developing your vocal technique, then check out my comprehensive online singing courses, where I'll teach you everything you need to know about voice care and establishing a rock-solid contemporary vocal technique. One technical component of good singing, often overlooked by many singers, is vocal onsets and offsets, something we look at in the online courses. An onset is the way your voice commences sound, and you guessed it, an offset is the way your voice completes the sound. They're basically the start and finish points of your phonation. The damaged voice will often struggle to start and finish sound in a balanced and efficient way. Ideally, the healthy voice should be able to maintain a balanced onset and offset while singing, whereas the damaged voice might have a sound that is scratchy or grabs as it starts to create sound. Of course, various onsets and offsets have stylistic applications, so it's important to judge this against what you normally expect from your voice, how it sounds and how it behaves.
Sudden changes in your vocal quality indicate that something is amiss. Something amiss may be going on.
Unexplained changes in the voice, such as persistent breathiness, changes in timbre, or an inability to control the voice as usual, can be a sign of both organic and functional issues, indicating potentially serious underlying conditions. We can expect the voice to be reliable and resilient when it is healthy. Suppose any of the 7 signs I've mentioned today have persisted over 2 weeks. In that case, I highly recommend you visit your licensed healthcare provider to obtain a referral to a laryngologist or a voice specialist ENT. Early detection and treatment of vocal issues can prevent long-term damage, so I encourage you to act sooner rather than later. Many vocal health concerns have a favourable prognosis of full recovery, but you must be proactive to bolster your personal outcomes. If you've enjoyed the video, I'd appreciate a thumbs up, and if you'd like more tips on vocal health and singing techniques, then take a moment to subscribe to the channel. I upload new videos every week that I think you'll enjoy. I'll see you again soon. I'm Dr. Dan. Sing well.